Still on health matters, 2 children have died of malnutrition since October last year in Wajir County, while more than 10 are admitted weekly in various health facilities. Wajir County Referral Hospital Chief Executive Officer Dr. Mohamed Bashir says 21.7% of children in the region have severe acute malnutrition, a situation attributed to persistent drought.
The ongoing drought in Wajir County has drastically affected livestock keepers in the region and beyond. The aftermath is dwindling milk production, whose ripple effect is malnutrition among children.
The president has declared a drought emergency much earlier in this year, but where it has reached, I'm appealing to His Excellency to send out special teams to actually upgrade the knowledge and what we know, and also upgrade the operation to support those who are affected.
Wajir County Referral Hospital Chief Executive Officer Dr. Mohamed Bashir and Head of Malnutrition Nuri Ibrahim say 11 children suffering from severe acute malnutrition are receiving treatment at the facility.
To know that malnutrition tends to makes you weaker to get diseases like pneumonias and diarrheas and all that. So it becomes a vicious cycle. A child becomes sick, they end up becoming malnourished, and when they become malnourished, they become more severe. So we have lost about 2 children from severe acute malnutrition since October last year.
But now some has also doubled. It is now 4.3%, which is also high, and currently the gum is at critical. So the gum is at critical is 21.9%, which is not good.
Leaders in the area, led by former Chief Administrative Secretary in the Ministry of Environment and Forestry Mohamed Ibrahim Elmi, say the situation needs to be addressed as a matter of urgency.
The trend tends to be increasing, and we are anticipating the numbers to increase, especially in our wards. The pediatric ward will most likely be overwhelmed by children who have severe acute malnutrition.
We scale up now instead of waiting when people have died. We need to increase our cash transfers and increase the food rations that are coming. The health sector and nutrition sector, this is the time to come in before the children, majority of them, go into serious malnutrition.
And the county government to intervene and bring enough food, especially for the children who are under 5 years.
This is even as they appeal for swift intervention to cushion residents against effects of drought.
Said per week usually receive more than 10. Compared to the previous, the admission is very high.
Children. The most vulnerable at the moment are children, lactating mothers, and pregnant mothers, and the elderly. And I just want to make an appeal to all government, all agencies, individuals, that we take this drought serious. In a few weeks, the toll of deaths, the human to human, will be very high.